The coronavirus pandemic continues and the Delta variant poses challenges with hospitalizations and deaths rising. I'm Anand Naidu. This is The Heat. Last week, U.S. President Joe Biden expressed the urgency of getting vaccinated after cases and deaths surged to a 6-month high.
Yes, cases are going to go up before they come back down. It's a pandemic of the unvaccinated. I know I've said that constantly, and others have as well. The vaccination of the unvaccinated.
This comes as the FDA looks to approve COVID-19 booster shots for those who are immunocompromised. But the World Health Organization is pleading for a worldwide moratorium for now on booster shots.
I understand the concern of all governments to protect their people from the Delta variant. But we cannot and we should not accept countries that have already used most of the global supply of vaccines, using even more of it, while the world's most vulnerable people remain unprotected.
We have a lot to discuss. Let's bring in our panel. Joining us from Tampa, Florida, is Erin Marie Olszewski. She is a registered nurse and author of Undercover Epicenter Nurse. With us from Austin, Texas, Del Bigtree is the CEO of the Informed Consent Action Network and the host of the HighWire with Del Bigtree. From Gaithersburg, Maryland, George C. Benjamin is the Executive Director of the American Public Health Association. And from Fairfield County, Connecticut, is William Haseltine. He is a former professor at Harvard Medical School, a virus expert, and chair and president of Access Health International. Well, welcome to all of you to the show. And Bill Haseltine, let me start with you. At this stage, looking at the vaccination picture in the United States, half of all Americans have been vaccinated fully, and about 70% have at least received one shot. Big effort now underway by the federal government as well as some big businesses urging people to get vaccinated right now. But given the spread of the Delta variant right now, mainly among unvaccinated people, what is your assessment of the pandemic in the country right now?
Well, we're in a very serious state. We have well over 100,000 people a day being infected. Our hospitals, especially in the South and certain places in the Northwest, are filling up. The number of deaths is rising pretty sharply, as are the number of cases of infected children. So it's a serious situation. The earlier characterization that this is a pandemic among the unvaccinated is no longer the case. Some of the regions where the virus is spreading most rapidly are some of the most heavily vaccinated areas of the country. So it's a much more complicated picture than we had expected.
So, Bill, the progress that was made up to now with vaccinations around the country, is that slowly being rolled back?
Well, it's not as absolute as it was thought to be earlier on. People who have been vaccinated are infectable. That's certainly true around the world. If you look at the country that's pretty much a canary in the coal mine, it's Israel, that was most thoroughly vaccinated, most earliest on. There's a very steep rise right now in Israel to the point where they're beginning to reinstitute some of the most serious control measures. So this is not only an epidemic amongst the unvaccinated.
Right, Bill, I want you to listen to a statement that was made by the Dean of the National School of Tropical Medicine at Baylor College, and that is Peter Hotez. This is what he had to say about the variant. Let's listen.
Delta is dominant. We've got to get our arms around that and focus on that. There's another variant out of Florida now, the B1621 that I'm looking at. That's starting to take off. If anything, I'd be more worried about that right now than the Lambda variant.
So, Bill, what can you tell us about these other variants?
Well, I've written a piece recently. I have a blog on Forbes, and I've just written a piece on both variants, actually. 2 pieces on Lambda and 1 on the 621. The 621 looks pretty dangerous to me. It's got most of the mutations that have driven the pandemic to higher levels, including the Delta, and it's got some extra ones. People focus only on the spike, but they should look at the whole genome, because this virus replicates to very high titers, and that's not only a function of the outside of the virus. So there are more and more dangerous ones on the way. Basically, what I wrote about 621, the title is A New Killer on the Loose.
George Benjamin, welcome to the show. Great to have you with us. This virus, as we heard, is spreading at the rate of about 100,000 people a day. President Biden has called it a pandemic of the unvaccinated. The current numbers show that just a little under 1/3 of the population remains unvaccinated. In addition to the infections, of course, there's reporting that some of the unvaccinated people can act as incubators for these variants that we've been talking about. What can you tell us about that?
Yeah, that's the biggest problem here, is that these viruses, as they go from person to person, they do replicate, and they replicate, very, very quickly, and they change, they mutate. The best way to stop this from happening is to get people adequately vaccinated so that they stop spreading the virus. The real challenge that Bill points out, and that Peter pointed out, is that we may, certainly if we don't do this quickly enough, we may lose the race, and we may have such significant new variants that it will totally escape the vaccines that we have right now. Right now, the vaccine does seem to at least hold this into check to some degree. And so if we can get everybody vaccinated, that's mission number one. And then, of course, contain it within people who are currently vaccinated to the extent there is some spread. That's mission number two. And then, of course, mission number three is to make sure that we get people focused on the science and not on the myths that we're hearing out.
Right. In fact, that was a warning that was issued by the CDC a few weeks ago when they said that this could mutate to the point where there will be a strain which could evade the vaccines that we are seeing right now. What kind of timeline are we talking about? I mean, is there an urgency now to get everybody vaccinated as soon as possible?
No, there's an extreme urgency. One of the challenges we have is, it doesn't take much for these things to mutate. Now, they can, take some time to do it. And, Delta was around last fall to some degree. But once it accelerated, it just really took off. And that's possible with this next variant that we're seeing.
All right, let's go to Austin, to Del Bigtree. Del, great to have you on the show as well. You are the CEO of the Informed Consent Action Network, which has been described as an anti-vaccination group. So just clarify your position for us. Are you totally against vaccinations, or are you for vaccinations but with certain conditions?
We are a consumer advocacy group that sets to make transparency in science. We're demanding better safety studies, full-term safety studies with real placebo groups. I'm a fan of science. I've been documenting and working in television, studying science and medicine. And so I support that. We believe that all things should be as safe as they can possibly be. When it comes to this vaccine, look what we're listening to. We are hearing from, Walensky, who's the head of the CDC, saying this vaccine no longer stops infection, no longer stops transmission, which my friend Bill just described very accurately. This is not a pandemic of the unvaccinated. In fact, the science shows us that it's the vaccinated that are actually mutating and creating these variants, because it cannot stop infection, does not stop transmission. Therefore, they can carry it and not even know they're carrying it. Whereas someone that's unvaccinated, their body will quickly develop an immunity against it and kill it dead. And that's why the only people that are safe right now in the world are those that are previously infected. It doesn't matter whether they were not vaccinated to begin with, or whether they've received the vaccine. Ultimately, it appears that everyone in the world is going to have to catch this virus before we will reach that herd immunity we hear so much about. So it really doesn't matter. We support those, we'll defend those that want to be vaccinated if they feel like that's a safer route forward, or those that don't want to be vaccinated, because either way, all of those groups are going to have to catch this virus, as being discussed now by heads of the Oxford School are coming out and saying this vaccine is not going to reach herd immunity. You have the head of the health department in Iceland, an island that is fully vaccinated, saying natural immunity is the only way forward. So So this idea that vaccinating people somehow protects us is absolutely just foolhardy to say that any longer. This vaccine is a disaster, it's a failure, and it is causing the variants, if anything, and is going to pressure this virus to become more and more deadly. If we relied on people that were having natural immunity, this world would have been safer. We should have allowed this to run its course. We should have protected those that were elderly and in harm's way, really put them aside, where those of us that were healthy enough to handle this virus, which really only has about a death rate of 0.2%. Less than 1%. It's about 1/4% that have died around the world. Those are stats that come from the biggest universities in the world.
Right.
We should have put our healthiest forward to catch this virus. We wouldn't be in this situation. Now we're going to have to do whatever we take to finally get to natural immunity by allowing people to catch this virus.
Okay, Del, you say the vaccination has been a failure, that it's been a disaster.
Yes.
But let's look at the situation now compared to the situation, let's say, 14 or 15 months ago, when we didn't have a vaccination. There's been a significant reduction around the world in the number of people who have been hospitalized and in the number of people who have died.
I would say that we're in the middle of the summer. We shouldn't be seeing any deaths or any sickness. This is actually one of the accomplishments of modern science, is to keep a coronavirus alive longer than we've ever seen it. We should be seeing no cases in the middle of the summer, but we locked down, we masked, we did things we've never done before. And I would say that most of those cases that we saw were due to, in many ways, mistakes by the medical industry. We didn't allow treatments that are now working all around the world, whether it's hydroxychloroquine, ivermectin, budesonide. All of these treatments are successfully recovering people. We should have used them earlier instead of having a political debate over whether they worked or not, or whether they were safe.
Right, Del, I just want to get to one point. I just want to get to one point very quickly.
Yes.
If you are saying that the vaccinations don't work, what's the alternative?
The alternative is treatments. The alternative is protecting those. We should probably work on lockdowns and take care of those that are in the very high-risk group. While we know our kids are not at risk, we know that people under the age of 65 have a death rate of about 0.05%.
Okay.
We can handle this. We just need to use treatments to get through it. It's our only way forward. It doesn't matter what science wants to do. It failed us.
Yeah, okay. Look, I want to go to the experts on this. Bill Haseltine, what do you make of what Del is saying?
He's either badly misinformed or mischievous. Most of what he said is not true. It's just plain not true. It's just misinformation. Many of the things he said are simply incorrect. So you can only make two conclusions: malinformed, misinformed, or deliberately deceptive.
Okay, and George Benjamin.
It would be nice to have an example. How about an example? Explain to me what I said that was incorrect. I'd love to have you on record saying it, because science will prove I'm right.
For example, ivermectin doesn't work. Hydroxychloroquine doesn't work. You need any more examples? There are many.
You're saying you all the studies.
Okay, one at a time.
Have you done a study on it?
It's hardly tolerable to listen to you.
All right, George Benjamin, what is your view?
Yeah, well, you know, the real world examples are absolutely show that Del is absolutely wrong. Look, when we started vaccinating people in nursing homes, mortality just fell to the floor. People weren't dying. People are not dying now. People are not getting any sick that are vaccinated, and that's just a fact. And it's not just a bunch of numbers. We're actually observing that clinically in the communities that we're seeing it. And even though there are challenges with people that are vaccinated, the place where this epidemic is raging is in those communities that did not get vaccinated, quite frankly. And you can see that in the numbers. And when you talk to the clinicians in those communities, they're having the experience that, you know, the New Yorks and the Chicagos had a year ago. So that's not true. And let's just take up the issue about natural infection. It's been pretty clear that natural infection does not protect you as much as being vaccinated. And to the statement that we've never done these lockdown things before and wore masks and stuff before, we did this over 100 years ago during the great pandemic when we didn't have vaccines, and they worked extraordinarily well. Washing your hands, keeping your distance, and wearing a mask was very, very effective many years ago.
All right, let's go to Tampa, Florida. Erin has been waiting very patiently for us over there. Erin, you've written a book called Epicenter, Unknown Epicenter Nurse, How Fraud, Negligence, and Greed Led to Unnecessary Deaths at Elmhurst Hospital. That's a hospital in Queens, New York. What did you discover?
They just mentioned the New York numbers, and I'm going to tell you why the New York numbers were so high. It was because of medical malpractice, negligence, gross negligence, and essentially murder, which I recorded undercover. There's a reason that they kicked the families out of these hospitals and nursing homes. It's because they didn't want them to know what was going on. And ultimately, all of these patients were being thrown on ventilators, drugged up with sedatives, paralytics, not coded when they were supposed to be coded. We saw Cuomo put, all these elderly into the nursing homes infected. It was an absolute nightmare. That's why so many people died in New York. That's what I recorded Undercover. And I think the urgency here is not to push a vaccine on people. I think the urgency here is to open up this open debate, because that's what science is all about. We should be able to talk about treatments, not being gaslighted and just say you're wrong. Because I saw in my hospital in Florida, we treated every single patient successfully out of the emergency room with hydroxychloroquine and zinc. When I got to New York, it was banned. We had 100% of our patients in New York by the time I got there had died. I saved one patient. So why are we not talking about how we can take care of our bodies? Why are we not talking about the vitamins and supplements? Why are we not talking about the hydroxychloroquine? Why was that banned by certain governors? Since when is it right for the government to get involved in the doctor-patient relationship? Never. That should be a sacred relationship. That's between a patient and their doctor. The government has no say in it. And the CDC has been wishy-washy, left and right. They keep changing their stories, and ultimately, this is what is causing so many deaths. The testing, the reason that there were so many cases is because they were doing testing on every single person. The cycle threshold on the PCR test matters. They've lowered it now. They're not testing the vaccinated purposely, and I have proof of that because I have nurses undercover right now.
Okay, Erin, my apologies. Of course, your book is called Undercover Epicenter Nurse, not Unknown Epicenter Nurse. But the point that you make there about what governors have been saying, what local officials have been saying, etc. I mean, they've not been saying this. They've been basing this on the science that is available to them.
Well, the science is available on the Johns Hopkins website. They actually keep track of all the beds that are used. So actually right now they're trying to make Florida look like we're overwhelmed with COVID patients. But if you actually look at the data, we're not at all. The ICUs are not full of COVID patients. They're full of regular patients. And why? Because they had these people sitting at home for the past year and they got sicker and sicker. So like, if we're going to look at the data, let's look at the real data, the real statistics, and let's listen to the people on the inside that are telling the truth and stop gaslighting them and blacklisting them. Yeah, well, these figures are coming from the CDC, from official sources. But the CDC is not telling the truth. It's unofficial. If you want to look at the official sources, you can find it on the Johns Hopkins website. They're keeping track of the actual data. The CDC is not putting those numbers out. The CDC is basing this off of the testing. And if they're going to be testing more, of course, we're going to find more. But these people are not dying. Let's talk about the 99% survival rate. Why do we need a vaccine when we have treatments available? Nobody wants to discuss that. Okay, I want to move on, though. Bill Haseltine, looking at some of the efforts being made right now, the federal government and some businesses are now moving to mandate vaccinations for workers if they want to keep their jobs. I mean, can these kinds of mandates shift the needle?
They certainly are changing the numbers of people getting vaccinated. A lot more people are getting vaccinated. Certainly 1/3 of the people in the military who have not been vaccinated are going to be vaccinated. Most people who work, all people who work for the federal government are now going to be vaccinated, the biggest employer. So it's going to shift the needle, yes.
Del, what is your opinion on that, these mandates?
Well, clearly they've been unable as an administration in this country to teach or get intelligent people to believe that getting this vaccine is an intelligent idea. Every poll has shown that those that are vaccine hesitant in the United States of America tend to be higher affluent and higher educated. It's the educated people in this country that are denying this vaccine because they've read the data. It's doctors and nurses not wanting to be vaccinated in their hospitals. It's police officers. It's fire department people, people that have been on the front lines, people that have received every other vaccine that ever existed. But this one scares them because of the data they're looking at, the data they're capable of reading. And obviously, when it doesn't stop infection, it doesn't stop transmission, it seems absurd that this product would be forced on anybody because it's not protecting anybody except for perhaps yourself. If you think it lowers your symptoms, go ahead and take it.
Yeah.
But you're not protecting Johnny or Debbie. You're not protecting anyone around you. The vaccine does not do that. So why force it on us?
But Del,
hasn't decision of how I want my health to be treated.
Hasn't the data been telling us something very different? I mean, if we look at the initial vaccinations around the country, it was a lot of affluent areas that got vaccinated very quickly.
I'm just telling you what the polls and the studies have shown. And then when we finally look at, we've got to get outside of our own bubble, the United States of America. As Bill pointed out, when we look at Israel, the most vaccinated nation in the world, they're now experiencing 70 to 90%, depending on the hospitals, 70 to 90% of the serious cases in hospitals and deaths are amongst the vaccinated, not amongst the unvaccinated. So I believe we're just in the beginning of seeing that happen here in America. We should have this debate in about 3 months. I think we'll see the highest rates of infection and death will be the vaccinated because the failure of this product.
All right, let me get some clarity on that from Bill. Bill, the increase in the number of people who are being infected in Israel, for example, what's behind that?
Everybody in Israel is vaccinated. And what's behind that is the virus changes. You know, I wonder what the people on this call's reaction is to the flu vaccine. Most people get the flu vaccine. We know that it doesn't work forever. We know the virus changes, and you need to be revaccinated. I suppose they might be opposed to that one as well, but we've had that vaccine around for many decades. We know it's relatively safe, yet we know that the virus keeps changing, and therefore we have to change the vaccines. I don't suspect that that's going to be any different from COVID. COVID really has the same ecological niche. Adults that are previously infected and are immunocompetent, the virus has evolved to attack those people. We can reduce the impact of the infection, and we have dramatically reduced the impact of the infection with vaccines, with influenza virus, and now with the COVID vaccines, and we can continue to do so. These vaccines aren't going to be perfect. We might have expected them to. I didn't expect them to be perfect, and they worked far better than I expected them to, but they're not going to work forever, and we're going to have to need new vaccines, probably have to be vaccinated every year to keep up with the changes of this virus. And so that's what's happening. It's not that vaccines are dangerous. It's not that they don't work. It's that the virus keeps changing, and the virus in 2021 is not the same virus as it was in 2019, just like the flu of 2015 is not the same as the flu of 2016. So that's what's going on. It's not a mystery. It's normal.
George, talking about the vaccine mutating, the United States is already talking about booster shots for people who've already been vaccinated. We've already seen that in some countries, France, Germany, and of course Israel as well. They're now talking about booster shots as well. But there's been a little bit of opposition to that from the World Health Organization, which is saying there should be a moratorium on booster shots right now until sufficient numbers of people in the developing world have also been vaccinated. They're trying to close the gap between the rich nations and the poor nations. How important is that?
It's absolutely important. We have to do that because, as Bill pointed out, and as Peter pointed out, those unvaccinated communities is where these new variants will come from. And when you have such a small part of the rest of the world vaccinated, that's where the variant's going to come from. So we have to do that. But the fact is, we also know that in our country, people that are particularly immunocompromised will need to get a booster. They'll need to get a third shot, and we can do both. And by the way, one of the things we also ought to focus on is making sure that these vaccines that we have that are about to expire get to places where they can use it. That would be my first step.
Del, what do you make of Bill Haseltine's point that we've had the flu vaccine for a very long time, and we have to have that updated every year because the virus changes?
Yeah, I agree with him that the virus does change. And I think it's surprising when he says this vaccine's working better than he thought it would, because we were told it would stop infection and stop transmission, which is why CNN and MSNBC and every news agency said, go out and get it to protect others. The CDC is pulling back that language now. Vaccines are supposed to protect me from being infected and protect me from spreading it to others. This vaccine doesn't do that. So to think that that is doing better than you imagine, then we lied to the public about what this vaccine was going to do.
But then if
when you talk about the fact that the variants change, he's right. But here's another point. Then why are we adding last year's death numbers to this year's death numbers in order to scare everybody? Because Bill is right. This is actually a different variant. Just like every year, we don't tag last year's flu numbers with this year's flu numbers and say, look, this many people died. We've got to start being better with the science.
Right.
It shouldn't be all put together. We're talking about a different epidemic now.
Yeah, Del, if the mainstream media told us that you've got to go out and get vaccinated and that will stop the virus from spreading, it has, to a large extent, done that, hasn't it? If we just have to look at the number of people who are dying more than a year ago, to the number of people who are dying now, who are being hospitalized now, it's reduced.
I don't think that you can accurately say that. I mean, I think you can look at what Erin Marie Olszewski just said.
Yeah.
She told you that in the places where we use ivermectin and hydroxychloroquine in treatments, we see lower death rates. There's a lot of hospitals doing that, even when they're being told by governors not to, because doctors have an interest in taking care of their patients. Many doctors I'm talking to around the world are using the treatments that have always been available, were always proven effective in studies all around the world. We're one of the few nations not using these treatments. If we use them, obviously we're going to see lower death rates. But I also want to say we're only brand new with this Delta variant. We knew the problem with the vaccine would be as soon as there was a mutation, because it's so specific. It's only giving you antibodies to one spike protein in one variant. That is tiny, and that is just a terrible way to create immunity. When you think your natural immunity is making you immune to 28 of the, or 29 different proteins on the virus, the entire virus. Once you've caught that, it doesn't matter if one of those little S proteins gets out of line.
All right, Del,
your body's fighting immunity for the whole virus. That's why natural immunity is lasting for every single variant we're seeing. All the studies show that. I don't know what George is.
Del, look,
time. The vaccine's better than natural immunity.
Del, time is catching up with us. Erin, you wanted to say something very briefly, please.
Yeah, I mean, I'm very tired of hearing the media discuss how the death rate is so much lower this year, and they're using the vaccine as their scapegoat, like it's the save all. The reason that the death rate is lower is because hospitals stopped murdering patients, and I don't use that lightly. They're still doing it to this day. We knew ventilators were the wrong treatment, but they continued to use it because there was financial incentive to do so. $13,000 to admit COVID patients, $39,000 to put them on a ventilator. They were incentivizing deaths at $10,000 a piece. Like, they treated this like an assembly line to a body bag. People don't want to pay attention to that. They're only focusing on injecting an experimental vaccine with no liability to the vaccine manufacturers. Why not? If it's so safe and effective, let's see some liability and some people taking accountability for all the people that we see.
All right, Erin, I'm going to give the last word to George here. George, go ahead. I mean, we were hearing here that there was a financial incentive for this.
No, there's no financial incentive. Hospitals didn't do this. We don't get into this business to make. Stop,
Erin, one moment. George, go ahead.
Yeah, I'm an ER doc. I spent my life saving people in emergency departments. Let me tell you something. We don't do that. We don't do that for the money. We do that because
there was financial incentive from FEMA to every single hospital.
Erin,
yes, there was.
I'm sorry. I disagree, and I've got to defend the hospital community there. You're absolutely wrong, and you're just wrong. There. And yeah, we learned a lot about managing the airway, and I'm glad we learned a lot about managing the airway. We don't intubate as many people as we did before, but we did that because that's the way we practiced before, and that was one of the scientific learnings we did around our practice.
Okay, and we have to leave it there. Thanks to all of you for being with us. That was a robust, great discussion. Thank you very much. We need to leave it there, though. I'm Anand Naidu in Washington, D.C. Thanks for watching another edition of The Heat.